Aloha, everyone, and welcome to Day 2 of the Statewide Homelessness Awareness Virtual Press Conference. My name is Adam Lefebvre, and it is my honor to be here with you today as your host for today's opening plenary session and welcoming remarks. Now, today we are honored to have Mayor Kirk Caldwell, who will be delivering our welcoming remarks, and Nan Roman, who will be giving our opening plenary. But before we begin, I'd like to go over a few brief housekeeping reminders. Now, most of you, and there are over 100 of you right now, are actually over 200 of you now, so thank you so much for being here, but most of you are attendees. And that means we can neither see nor hear from you, but you can see us. However, we would like to hear from you in the Q&A session, and that you can participate in the bottom right of your WebEx browser. We'd love to hear your questions, and time permitting, we'd love to answer them to the best of our ability. If you happen to get disconnected, please go to the Office of Housing website, which is honolulu.gov/housing, and find the appropriate links to whatever session you were disconnected from, whether it be the opening plenary or one of the breakout sessions. I'd also like to remind everyone who is in our panelist section to please be sure to mute yourself when you're not actively talking to avoid bleed over of your audio into other people's presentations. I'd also like to remind folks that are looking for the CEU credits that you can find a PDF download of the conference evaluation and CEU application form on the website at honolulu.gov/housing. Now, this opening plenary will be ending at 10 a.m., at which point we'll be going into our separate breakout sessions. And I'd like to remind all of our panelists and everyone here that we're going to try to stick to a good timetable to make sure that we have enough time for everybody.
Thank you, Mayor.
Now, at this time, I'd like to introduce our opening speaker for our welcoming remarks and aloha, Mayor Kirk Caldwell. Now, when he took office in 2013, he started with 5 priorities. That's bus, rail, roads, sewers, and parks. And he's made incredible progress on all 5 of those priorities. However, shortly after taking office, he realized there was another priority that should really be included in that list: homelessness, a growing problem that needed to be addressed. So he immediately made it a new priority. He assembled a killer team, and together they have made strides on an unprecedented level in addressing the homelessness epidemic in our community on Oahu and really providing an incredible impact to people suffering under the burden of homelessness. At this time, I'd like to introduce you and welcome our opening speaker, Honolulu Mayor Kirk Caldwell.
Good morning and aloha, folks. I really appreciate all of you dialing into the Zoom call on, I think, the most difficult issue that faces the city and county of Honolulu and the state of Hawaii. And I would say it's one of the most difficult issues facing our nation. You know, we're fighting a pandemic right now, but there is a solution to the pandemic in the vaccine. And we know that they're going to be completing approval shortly and starting to get distribution of the vaccinations out. And at some point, the virus will go away. But in the challenges of homelessness, it's a problem that is so multifaceted, as all of you know, and is never ending because the next generation of folks fall into homelessness, next class falls into homelessness, and so we have to do a better job on so many levels and on so many fronts that it's a problem of epic proportions to solve. But it cannot be solved without you who are on this call today. It cannot. It is all hands on deck, and it literally means exactly that. From every level of government, from our federal partners to our state partners, to our city partners, to our NGOs, not-for-profits, and really each of us as individuals have to do more to tackle this never-ending problem. You know, as Adam mentioned, when I came into office, we had a rule of the hand, only 5 priorities, and added a 6th priority. And what I did, before I did, I had my own political kitchen cabinet, and they said, Mayor, don't add homelessness as one of your issues to tackle. And I go, why? They said, because you're going to go into the Okefenokee Swamp. And I asked them, what is the Okefenokee Swamp? And one of them had a laptop, pulled up the state of Florida and showed me where the Everglades are outside of Miami and said, this is this huge swamp. You go in, it's so difficult to tackle, don't go in. You won't come out. But I stepped in because I believe as a mayor, homelessness is a problem. It's a city problem. It's a state problem. It's a federal problem. It's all our problems. And I cannot, and I would not, do what others have done by saying, no, it's a state issue. Let them deal with it. That'd be hypocritical. So I stepped in. And I have to say I'm up to my neck in the challenges. And people are not appreciative of some of the things that we're doing. We have this program called Compassionate Disruption. And it is a little bit about tough love, but with a lot of compassion. And I wanted to talk about that a bit because I end my 8th year, 28 working days left in my term, 28 working days left in my term. And we're not stopping. The next 28 days, we're going to continue to work hard to address the problem. So while there is the disruption part where we do have enforcement actions, we don't call them sweeps because enforcement is based on laws, and we are enforcing based on laws, not just on whim or feelings or thoughts. Laws that are passed by the council and others. So we do have enforcement actions, we have sit, lie, and those things. And I know maybe some of the people on this call don't support them. But we also have the compassion side. You know, through our 8 years, you know, we've embraced 100% Housing First. We've housed thousands of people in Housing First. And we know it works, and you know it works. In fact, I think it's the only thing that does work. I think shelters are a short-term solution, and it's really, at the end of the day, not a solution. It's getting people into housing permanently where they can address their issues, whether it's getting a job, addressing addiction issues, psychological issues, health issues, while they're in a place that is clean and safe, just like the rest of us. We all have our issues that we need to address and the challenges we need to face, and the rest of us are lucky enough to do it in a home, in a place that's safe. So we've done that, but we've also done very, very innovative things. You know, our Sand Island program, you know, was with using containerized housing. Low barriers, almost no barriers. Come with your pet. And it's worked in spades. It's filled 100% most of the time. Many people have transitioned through this program. You know, they have even a garden that they tend to and nurture. And it, in turn, I believe, nurtures them. That was one of our early initiatives in the first years of our administration. We did Kauike Village, a public-private partnership where the state gave us property at Ke'e Lagoon, and we in turn gave it to Dwayne Carrizo and his team for $1 a year. We then stepped up and took care of grading the property and putting down wrap from a road repaving. Wrap is like the leftover asphalt, so it's smooth and neat. We put in utilities, sewer, water, and then we worked with the private sector to do the rest. And then our own cabinet went down and helped build units. It's an example of working together, a true public-private partnership where there's over 500 people living there today, mainly women and children. There's a school there. There's a post office there. There's a store there. We need more of these types of Kauike villages around this island. And we know it can be done because we did it. We also believe in hygiene. So we had a small hygiene center down in Chinatown. 1 bathroom for women, 1 bathroom for men, where you got a towel, you got toothpaste, soap, toothbrush, shampoo, conditioner, where you could at least go and get cleaned up every day. And of course, if you just had to use the lua, you could use the lua too. And it's used all day long, the entire time it was open. And so we saw how it worked. And then working with Joy Monahan, who I hope when you see him someday you can give him a hug again. For now, give him a virtual hug. You know, has really stepped up in terms of accepting housing initiatives in his district. You know, most politicians say, we need to solve the problem. Just do it. Don't do it where my district is, because people are going to oppose it. So do it here, do it there, but not where I am. And everyone's pushing it somewhere else. And Joy stepped up and said, you can do it. So Sand Island, Kauike Village, they're all in his district. But we started with the Punavai Rest Stop, initially a hygiene center on steroids. We had a lot more showers and bathrooms. We had places, we had a lot of washers and dryers. We had a bed bug zapper. You could receive your mail. We had a little post office. You could pick up your mail. You could do things online. They had computers, chargers. They had a little bit of medical treatment center. They could help people get their IDs, find other help, and it's helped tens of thousands of people since it's open. And during the pandemic, it's been open 24 hours a day, 7 days a week. And you go down there, it's a place of great hope and restoration. And just this week, we announced we completed the top 2 floors. They're going to have rooms for people to live in, permanent supportive housing. But the beauty of it is on the mezzanine floor, there's going to be a temporary clinic opened up, and by this summer, a full-on clinic like you'd find in a hospital to treat those who need treatment but not so severe that you need to be placed in a hospital bed at Queens or Kapiolani or Straub or Kaiser. That you could be taken by EMS to this Punavai Rest Stop Treatment Center, be treated, and unlike what you see on Punch Bowl, people check into Queens, injured, an infection, treated, and they're put right back on the street, and you see them lying on the sidewalk in their medical gown. Heartbreaking. Instead, they go to this Punavai Rest Stop, they're treated, and then they're placed in a room in a hospital setting until they can be stabilized, their wounds can heal, and then they can move into permanent supportive housing on one of the upper floors or into other housing that we find for them. This is the first ever in the nation type program. And yes, it required a lot of effort by the city government, took a lot of effort by Joey Monahan and courage and bravery. Buying the building was in the tens of millions of dollars, and building it out was in the tens of millions of dollars. But now we have a facility, first ever in the nation, to take care of people, and an example of what more can be done. And I was so proud we were able to do it the week before Thanksgiving, because it gives us hope and something to be very thankful about during this pandemic. We have other programs ongoing around the island. We built housing on the west side. We built housing on the North Shore. We continue to buy buildings to move homeless folks into in the urban core, Macaulay, Moilili, all around town. And we're going to continue to do this till our last day, and I know the new administration coming in, working with all of you, will continue to do it. That doesn't mean that homelessness goes away. There's probably, another 2,500 unsheltered homeless in that range as we sit here today and talk. And that number is held steady for way too long. So while we house people, we have more people who become homeless. And with the challenges of the pandemic, we could see even more. And I guess if I could have powers beyond my ability, I would really ramp up the medical component of the homeless challenges that we face. As we enter administration, Chinatown, which has been neglected for years, has gotten a lot of attention. We're power washing every sidewalk in Chinatown all the time. Every evening we're out there power washing sidewalks. They've been power washed multiple times already. We've replanted trees in every tree well in Chinatown. We're covering up graffiti. We have locking green bins to deal with garbage. And yet if you ask people, how's Chinatown, they say homelessness is out of control in Chinatown. And I see it in the mornings, on the weekends when I go there. Homeless folks who are not in a shelter or in a permanent supportive housing, who are addicted to something or have mental illness, waking up and walking down the middle of streets, crossing in the middle of streets, no help being provided. And if I could have the ultimate power, I would create greater capacity in the Department of Health to take care of this part of our chronic homeless population, get them into treatment programs, find easy pathways in with unlimited amounts of money, staffing, and support to address this challenge. Not just short-term, but long-term, because folks with illness and mental illness and addiction need to continue to be kept on program. Not just to do it at one time, but multiple times. That's something that's not in the wheelhouse of the City and County of Honolulu. We do not have a Department of Health. And so I'm asking those on the call to reach out to the state, to reach out to our Lieutenant Governor, who's a medical doctor himself, who says he is the homeless czar for the state, to provide the medical component that is missing from this program, and to take an all-hands on approach with this part of our challenge to the homeless problem. And if we do, I think we'll see a vast amount of difference, and it gives us breathing room to address the other challenges we face. So with that, I wanted to thank all of you who are participating today, and I want to thank all of you who have worked with our administration for the last 8 years. You may not always agree with what we're doing, but I know that you come from a place of love. Just like there's disagreements in families, we all hang together as a family. And we're a family in this room. We only can get through this as a family. So as I go into Thanksgiving, I have great gratitude for all of you in what you've done to help address probably the most difficult problem we're facing here in the City and County of Honolulu. Thank you, mahalo. Be safe. Please don't gather more than 5 during the Thanksgiving period. Please get that message out. Unless you're a family of more than 5. If it's your household unit, family unit, fine. But don't reach out to your brothers and sisters from other households. Keep yourself safe, keep them safe, and keep all of us safe. Mahalo and aloha.
Thank you so much, Mayor Kirk Caldwell. Your leadership through this time, we are so, at times when there is a vacuum of leadership, we are so grateful to have strong, compassionate leadership, especially during trying times, and we are so grateful to have you here at the helm when the seas get rocky. So thank you so much for everything that you do. At this time, we'd like to move on to our opening plenary speaker, Nan Roman, who's going to be talking about, after the election, impacts on assisting those experiencing homelessness. Now, Nan Roman is the president and CEO of the National Alliance to End Homelessness, a public education, advocacy, and capacity-building organization in the United States. She is a leading national voice on the issue of homelessness, and under her guidance, the Alliance has successfully identified and promoted innovative strategies for ending homelessness that have been adopted by communities across the country. Ladies and gentlemen, please give a warm welcome to Nan Roman.
Well, thank you so much. I really appreciate being here with you. Thank you to the mayor, to Mayor Caldwell, for his leadership and obviously his passion on the issue. I certainly wish I could be together with all of you in person, but it's still really a pleasure to join you in the virtual world that I guess we've all become willingly or unwillingly familiar with the past few months. We come together at a tumultuous and challenging moment in our nation. We have the COVID-19 pandemic, of course. With respect to homelessness, this has presented a lot of challenges. We've surveyed all of the nation's continuums of care 3 times since March, and a few things that we've heard from them that may resonate with you in Hawaii. A third of COCs have added shelters or shelter beds, but a third have reduced shelter beds. About half have expanded their diversion activities. Half are experiencing staffing shortages, primarily of frontline staff, volunteers, and staff that are qualified to work with challenging populations. About 80% say they think that more people are asking for help. 2/3 believe that unsheltered homelessness is going up. We don't have data on that, but that's their sense. With respect to race equity, 2/3 say they are designing more equitable outcomes on the housing front in terms of housing people, but only 1/3 or less say they're doing anything to improve equity in COVID testing, street outreach, isolation, or services, and 1/3 say they are taking no specific steps to improve equity. Over 90% say there are likely to be increases in unsheltered homelessness moving forward. So those are some of the challenges that we're hearing about from communities that they're facing with respect to the pandemic. From what I have seen, it looks like you have been lucky with respect to COVID, with a lower positivity rate than many places and no real spikes that we've seen on the mainland. Also, unlike the mainland, you don't have winter coming up, which is a big threat here to worry about. But I think you have been very much affected by the economic impacts of the pandemic and by the recession. And I imagine that in Hawaii, as in the rest of the states, COVID and the recession and homelessness all hit racial minorities the hardest, such as the significant disproportionality among Native Hawaiians, Pacific Islanders, and multiracial people experiencing homelessness there. So these challenges around COVID, the recession, and racial equity have been intense over the past months. Even in the midst of these difficulties, though, we have real opportunities. And it certainly looks like you have a lot to build on here in Hawaii, where despite the challenges before and after the trifecta of the pandemic, the recession, and racial equity, homelessness has gone down, as I understand it, 18.4% since 2016, I saw in some of your data reports, with decreases among families, veterans, and chronically homeless people. Despite that progress, I know, though, that your goal is to end homelessness, and certainly that goal, as the mayor described, has not been achieved. So looking forward now, what are the challenges that are coming, and what are some of the opportunities and things that we can be thinking about that would improve our systems in the future? Well, in terms of what could be coming, clearly COVID is not going away anytime soon. And while next year we certainly should get progressively better, especially with the emergence now of vaccines coming, we may not be returning to anything entirely normal much before 2022. We know that the economic issues will carry on and that they will persist in disproportionately affecting the lowest income people, women and minorities, and those more likely to have service and hospitality jobs. People will continue to experience low wages and periods of unemployment. Critically, unless the eviction moratorium is extended, which is set to end on December 31st, and it doesn't look likely at the moment that it will be extended, and or unless there is serious investment in rental assistance, which also is not looking good to happen before the eviction moratorium ends, and unless unemployment benefits are extended, and those extended unemployment benefits are mostly set to end December 26th, and that also does not look that promising, that they will be extended beyond that. If those things happen, we have the eviction moratorium, we don't get rental assistance, and we don't get an extension of unemployment benefits, there is very likely to be a wave of evictions in January of 2021. Some of those people evicted will end up becoming homeless. It is unlikely that that will happen immediately, as homelessness tends to be a lagging indicator during recessions, although this recession is different because of COVID than other recessions. But still, I doubt that we'll see a big surge in demand for shelter, say, the beginning of January after the moratorium ends, but more likely we might start to see significant increases in homelessness in the spring and in the summer. Another challenge ahead is that despite continuing and growing need around the pandemic and the recession, state and local governments are largely broke from trying to handle the increasing demand on them for assistance with shrinking resources from tax revenues and elsewhere. So they're going to have a hard time meeting our needs moving forward. The federal government could step up because, of course, it can more or less print money, and it may or may not take on a bigger load. It's really hard to tell about that now. We'll have to wait and see. If the Republicans do hold the Senate, I would guess we'll have a more conservative fiscal environment than we would if the Democrats took the Senate. But again, we'll have to wait and see on that one. There are some serious demographic concerns also that I think we need to think about moving forward. The homeless population is aging quickly. The aged homeless population will double by 2025 and triple by 2030. And we are not really equipped to handle the health needs of this group in either shelter or in housing or permanent supportive housing. The cost of housing assistance for this group to get everybody who's older into housing would be easily offset by healthcare savings that would result from that, because housing would improve their health and reduce their their healthcare costs, as well, of course, as ending their homelessness. But so far, that strategy has not gained any traction. A second demographic concern is around young people and their attachment to the labor market. A major factor in the emergence of homelessness in the early 1980s, and we really did not have widespread homelessness in the country prior to the 1980s. A big factor in it emerging was a large cohort of young people, a high percentage of whom failed to attach to the labor market because of the recessions in the late 70s and early 80s. The big driver was housing, with the loss of affordable housing, but this youth cohort issue contributed to it. Many of those young people who never really attached to employment became homeless, and that cohort of demographic cohort has been the dominant group of homeless adults since then. It's still, they're older now, of course, but it's still the largest group. I am deeply concerned that a similar thing could happen now with a similarly large cohort of young people today. There's not only the recession and the lack of jobs, which we saw in the 80s, but added to that are the education situations that young people are facing with virtual schools, barriers, virtual schooling, and the barriers that virtual schooling presents to people with less access to and experience with technology and to non-English speaking households. Also, there's the interruption of higher education with not having classes on campus, young people dropping out of school. Together, these things may compound the market challenges that we saw in the 80s, resulting in a large group of young people unable to qualify for, find, or retain steady, well-paying employment. And this must really be addressed so that we don't face just an entire new wave of homelessness moving forward in the coming years. So those, sorry to be so grim, those are some of the challenges that we will face. But despite these challenges, I feel that there are some unique opportunities that could help us accelerate progress toward our goal of ending homelessness if we're bold enough to seize them. The Alliance, together with our colleagues at the National Low-Income Housing Coalition, the National Health Care for the Homeless Council, and the Center on Budget and Policy Priorities, these are all national advocacy groups and policy groups, have developed a framework for equitable COVID-19 homelessness response, which you can find on the National Alliance to End Homelessness website. If you want to look at it, the website is endhomelessness.org. This framework is focused on how jurisdictions should respond to the pandemic and the recession and try to come out of it better than we went into it, with an improved and more outcome-oriented approach to homelessness. The framework has 1 million recommendations in it, but it has a few key values that I think are relevant to us thinking about the future. The first is a commitment to address racial disparities. We know that these disparities drive a lot of homelessness, and it's going to be pretty hard to end homelessness without addressing them. There's a lot of will and commitment around doing a better job on race equity issues at the moment, which is encouraging. One way to do it is to involve people with lived experience, people of color, and others affected in planning and implementation of what we do. Another way is to collect and analyze data that can reveal any disparities in our services and the outcomes we achieve with our services, and then take steps to remediate those disparities. The framework also has an equity-based decision-making tool that was created by NIS, National Innovation Service, and the Alliance, where I work, also has just introduced an online center for learning And that center is about to have a racial equity course that will go up there as well. Another important value of the framework is the imperative to help people with the highest needs first. We are often tempted to help lower need people first because it feels like we could help more of them and we can move them out of homelessness faster because they don't each household isn't as expensive to help. Unfortunately, though, it doesn't work that way, and not focusing on the high need people actually tends to result in increasing, not decreasing, numbers of homeless people. When we are talking about homelessness funding, people who are homeless and unsheltered people, older people, medically vulnerable, disabled people should be helped before people with less serious barriers and problems. This is also a race equity strategy because people with more serious problems are more likely to be people of color because of systemic discrimination in areas like healthcare and housing. Having said this, though, it is important that we don't only help the highest need people. There needs to be some balance. In some places, the coordinated entry system, which was designed to meet the goal of helping to get the highest need people assistance, has resulted really in just a very few people getting any kind of significant help, and the vast majority of people really not getting any help. And that's not what we need either. So we need to create some balance and provide everyone with some assistance while still concentrating resources on those with the highest needs. It's also important to note that people who are left out of any assistance, those people who really don't get much of anything, tend disproportionately to be individual adults. I note that here in Hawaii, you have reduced veteran and chronic homelessness, which I'm guessing is largely individual adults, and that is great. But likely the majority of your population that gets very little assistance is still individual adults. And I think we just need to figure out ways to be more responsive to that needs of that population. We often hear that it would be better to prevent people from becoming homeless rather than waiting to help them after they become homeless. And this is absolutely true. It would be much better to prevent homelessness. Unfortunately, no one has really figured out how to predict with any accuracy who would become homeless. Nevertheless, a lot of homelessness funding gets spent every year, not on homeless people, but on eviction prevention, under the theory that eviction prevention will stop people from becoming homeless and thus reduce homelessness. Research and data indicate that eviction prevention is really a very poor tool for preventing homelessness. Very few people who are poor and evicted become homeless. The vast majority of people who receive eviction prevention, probably 85% or more, would never have become homeless in the first place if they didn't get the assistance. While the national data is not great, it generally appears that eviction is the cause of homelessness for less than 15% of people, and likely a smaller percent of evictions result in homelessness. Eviction prevention, don't get me wrong, is critically important thing to do. We need to do it so that people can remain stable in housing. It's just not a great homelessness prevention strategy. Jurisdictions should be doing eviction prevention. They just shouldn't be doing it with the homelessness money while we still have a lot of homeless people. And they shouldn't see eviction prevention as a key tool in preventing homelessness. It doesn't achieve that goal. Homelessness prevention and diversion are much better strategies for trying to keep people from becoming homeless, and I'm going to talk about them in a moment. A third important value of the framework is that our goal should be to house people, as the mayor said, not just to get them into shelter, hotels, or motels. Housing is the best protection for people's health. It's the best thing that we could do to ensure a solid economic recovery, to get people into employment, and the best thing we can do to achieve equity. And those are our goals at the moment, so we should focus on housing. And a final value is the need to act much more quickly and with much more urgency as we're addressing homelessness. When the pandemic hit, I'm sure that you acted very quickly to try to protect people. It's difficult, definitely, to maintain a sense of urgency for years on end. And of course, we have been fighting homelessness for years on end. While homelessness is an urgent problem for the people who experience it, the homelessness system often doesn't act like it is an urgent problem. It lacks the sense of urgency. There's the intake process, and then there's assessment, and there's moving to a shelter. There's scheduling time with the case manager. There's collecting all the information about to fill out the forms. There's seeing where you stand with respect to priorities. There's waiting for things to become available. Nationally, the length of time that people spend homeless is going up. We need it to be going down. We're spending a lot of money on this time that people spend waiting to get an outcome, and that's taking the money away from the solutions. We need to find a way to get back to addressing people's needs much more quickly. We'll save money on emergency services that can then be used for housing and services that solve the problem. So given all of this, what are some of the things that you could look at concentrating on here in Hawaii that would help you avoid the pitfalls of COVID and continuing recession and racial equity issues? Where could you improve things that would make a difference? First, I think going to scale on the things that you know work. There's a lot that you're clearly doing right here: permanent supportive housing, housing first, the work with families and veterans is succeeding. And in the context of the pandemic, you're doing a great job, I understand, of getting people who were quarantined or isolated in motels and hotels back into housing and not back to shelter. So scaling up in these areas where you have proven outcomes really is critical. That will take capacity building and investing in your system so that those needs can be met to scale. A second thing is taking on unsheltered homelessness. The mayor also mentioned this. From your data, it looks like your unsheltered population looks somewhat different from that of the other states, with most people experiencing unsheltered homelessness only once and briefly. Our data indicates that unsheltered people have much poorer health than people living in shelter, and they need to be housed very quickly. If indeed most people are not unsheltered for long, you're halfway there in terms of getting them quickly into housing and connected to services. A lot of jurisdictions are dealing with unsheltered homelessness by sanctioning encampments or creating safe parking. Given your short lengths of stay among unsheltered people, I definitely would not recommend those strategies, which have very poor outcomes and seldom result in people exiting homelessness. To meet the needs of the unsheltered people and the needs of the community, rather than enforcement of sit-stay laws and things like that, I think quickly housing unsheltered people and connecting them to services is the proven strategy. If that's not possible, you may need to look at increasing your supply of shelter, placing more people in hotels, motels, and so on. While we don't recommend eviction prevention to reduce homelessness, as I mentioned, diversion seems to be extremely effective in terms of both cost and outcomes. Diversion is a strategy to help someone who has just lost their housing and become homeless, but has not yet entered shelter or gone to live on the street. Diversion programs try to find a way to house the person before they enter shelter or go to the street. They may be able to return to their previous home. They might be able to go stay with someone else, to rent a room, whatever it takes. I know that you have some successful diversion mediation programs here, so that could be another issue of just scaling those up. I know it can also be difficult to get flexible funds to operate diversion. Diversion doesn't work for everyone, and it should never be used to deny anybody shelter. But it can be a very cost-effective and effective strategy overall. There is some data that indicate that once someone enters shelter, it can take months to accomplish an exit to the same housing that diversion would have gotten them to in days or even hours. I said earlier that homelessness prevention can also be an improvement over eviction prevention in avoiding homelessness. Homelessness prevention is prevention that's targeted to people that data has indicated are likely to become homeless. This data is weak, and most people who receive homelessness prevention also would likely not have become homeless, but more so than those who receive eviction prevention. There are more options under homelessness prevention than just stopping the eviction. And previous episodes of homelessness, I should point out, is the most reliable predictor of someone becoming homeless. A critical component of the race and equity discussion has been the importance of engaging people with a broad range of lived experiences in all elements of planning and implementation of homeless programs. I mentioned that before. It's similarly important to ensure a full range of culturally specific programming and including leadership of people with cultural familiarity and competency for Native Hawaiians, Pacific Islanders, multiracial people, and other racial and ethnic groups. I think this also holds true, if in a somewhat different sense, for people with disabilities and for LGBTQ plus people. We have an over 7 million unit shortage of affordable housing in the nation, and that is clearly a major driver of homelessness. Developing new housing is expensive, and we're losing ground on that. However, I don't know what the details are in Hawaii, but the real estate market seems to be changing with record low interest rates. That's universal, I think. Flight from urban areas and growing vacancy in motels, hotels, retail, and commercial property. There may be real opportunities to repurpose commercial use buildings for housing at much lower costs and at a much faster pace than for housing developed through new construction or substantial rehabilitation. If feasible, and at the National Alliance, we actually have some consultants that are looking into this, repurposing hotels, motels, and commercial and retail property could be a win-win-win in not only increasing the supply of affordable housing, but bailing out floundering hotel and motel and other property owners, not our number one objective, but not a bad one, and in creating new jobs. California is acquiring thousands of hotel and motel units this way, and many other jurisdictions are getting on board to do that. There has been a lot of discussion about the use of congregate shelter in favor of non-congregate shelter spaces, like in hotels and motels. Congregate shelter can be traumatic, unsafe, and unhealthy. Most people experiencing homelessness don't really like congregate shelter. Certainly, COVID-19 has pointed out the public health challenges of any kind of congregate living, including shelter. Our framework that I mentioned before recommends that jurisdictions seriously consider eliminating congregate shelter, reducing the amount of congregate shelter, although we certainly recognize that there has to be a balance between using resources to improve shelter and providing permanent housing. These suggestions are, of course, about accepting the status quo in a way, playing the hand we're dealt and trying to run a better homelessness system. We can certainly think bigger than that, however. We could create a nation in which there was a floor beneath which we would not let people fall. We could ensure that everyone has a decent place to live, health care, and food. These are not things that are beyond our means as a nation at all. We basically have just decided that we're not going to do them. It's really about priorities. We will see if a new administration can make progress on these broader goals. They have endorsed those goals, essentially. They've endorsed in their transition documents an entitlement to housing assistance and health care for everyone. It would certainly be so much better for all of us if people's basic needs were met and no one had to become homeless, and then we could help them take on other kinds of problems. We face many big issues in our nation, and as you do in the state, there are a lot of big problems, and it can be tempting to say that we can't end homelessness until we solve all those problems. We all have to work on these issues of justice, absolutely, it's true. But I believe that the work of ending homelessness doesn't have to wait until justice is fully achieved, but rather can contribute to the achievement of justice. And I think that that's what all of you are doing. And I want to leave you with this. I think we have it in our power at this moment to do something big, something significant about homelessness. We have some additional federal resources, and if our work at the national level, and I hope you're also advocating for it, is successful, we may get some additional federal resources. There's increasing political will. You all have a lot more knowledge and determination. those are the ingredients it would take to really make a difference. We can make change. We can do it better. We can act with urgency to move homeless people into housing faster and connect them with the services they need. And now, perhaps surprisingly, I think turns out to be not a bad moment for us to try. Thank you so much for inviting me to be with you. I look forward to the time when we can be together in person to work and to move forward to end homelessness.
Thank you so much for your wonderful words on homelessness. We do have about 15 minutes before we start going into our breakout sessions. So if you'd like to stick around, we'd like to have a few questions from the audience. We've already had a few come in. And of course, I'd like to encourage anybody who has any questions that they'd like to ask the panelists to please participate in the Q&A window on the bottom right of your WebEx browser. So our first question is from Bethany Hicks, who's asking you if you could please talk more about the older adult homeless crisis and strategies for this, for older adults. I see many people, mostly men, that cannot attend to their ADLs living on our street in Hawaii.
Yeah, I mean, this is partly a demographic problem as the older, the age cohort of older people, the population as a whole is getting older, and so is the homeless population. And there's a timeline there too, because we're going to see more older people, and then it's going to drop off also, sadly, because if they're homeless, they're probably going to die earlier than if they weren't homeless. And we're just not really prepared for that, as you're saying, in our system. One of the things is, though, that older people, elderly people are eligible for other kinds of assistance, and the rest of us are. They can get benefits. And I think that what we're working on with some jurisdictions is the idea that if we could just get a shallow rental subsidy for older people to supplement the other benefits that they give, it would probably save enough in healthcare costs to offset the cost of the rental assistance. And Dr. Dennis Culhane, who some of you may be familiar with from the University of Pennsylvania, who's done a lot of the research on homelessness, probably one of our more prominent homelessness researchers, has a really great paper looking at this aging population in several cities and explaining what the costs around providing a rent subsidy, a shallow rent subsidy, might be.
Thank you so much. Rates of homelessness closely follow the cost of living across the country, for example, in San Francisco and Seattle. Shouldn't part of the strategy to prevent homelessness be a focus on increasing the number of low-cost rental units?
100%, yes. And at the National Alliance to End Homelessness, we spend a lot of our time advocating for affordable housing. And this is why I was saying also this idea of just because of the economic recession, we're sort of a strange situation in which there's a lot of vacant property. I don't know what it looks like there. In Washington, D.C., where I am, there's nobody downtown even now, and I think it's pretty certain that many places are not going to return to having staff only at the office. So there's going to be property out there, and investors that want to move into a different kind of investment. And housing, of course, is very expensive, and it's looking like a better prospect moving forward. So I think that's a private sector sort of side of the equation. The Biden administration has proposed a right to housing, everyone getting housing voucher who's eligible, and they've also proposed massive investments in development of affordable housing. We'll see how the budgets play out as to whether that happens. But certainly, Section 8 pretty much ends homelessness for people, and we need to increase the supply so that people can find apartments more readily. You're exactly right.
Thank you. Have you heard anything about the focus of the incoming administration post-election with regards to homelessness? You touched on that briefly in your previous. Would you care to elaborate?
Well, some of the other things that they've talked about doing, and we don't know what's going to happen. There were campaign positions taken. Now you can go on the Joe Biden dot something. I can't remember. COM maybe, and look at the transition policy recommendations around housing. But they have said that they're going to stand firm behind housing first and restoring housing first. So I think that's good. They've talked about a lot of work around domestic violence. They're very, very interested in racial equity work, and they're very interested in trying to help around COVID, if there are specific things around COVID. They're also talking about trying to elevate U.S. Interagency Council to the Domestic Policy Council so that there's more coordination among agencies, like housing agencies and HHS, where the services are, so that those things coordinate better. So they have a number of people working on the transition that are very familiar with these issues. And the thing is that, I really, despite this, I think they're going to be quite overwhelmed with some of the other, with COVID, with the recession. I know they understand the housing and homeless problems. I doubt that they're going to be top priorities at the beginning of the administration. It's just hard to imagine they can be, really.
Thank you. So we've had quite a few questions roll in, and we have about 8 minutes to get through them all.
Okay, I'll be quick.
Yeah, let's do some rapid fire questions here. You mentioned focus should be put on the few who need a lot of help instead of the majority who need a little help. This seems counterintuitive. Can you explain further?
Well, if people have more serious problems, they tend to stay in the homeless situation longer, and that therefore they cost more, and the numbers just don't go down when we do that. So I know it seems counterintuitive, but it actually works better to reduce the numbers. And I think we have the data that showed that from 2007 to 2016.
Do you have any comments on the rumored policy of some states to ship homeless people off to other states, like Hawaii?
I don't really have any comment on that. I think that I would be surprised if people were shipping a lot of folks off to Hawaii, because wouldn't that be kind of expensive? I don't know. Probably better off shipping them to the state next to them. This comes up a lot, but when you look at the data, most places, the percentage of people who become homeless who are from the area are pretty much mirror the percentage of people who live in any jurisdiction that have been in the area for a period of time. It doesn't look like it's happening in any systematic way, in other words, shipping them off.
Gotcha. Is there any way that we can improve the process of application, waiting, paperwork, et cetera, for getting people into shelter through Section 8?
For getting people into housing through Section 8, I'm assuming that may be. I don't know how things work there, how your lists work and so forth, but I do think, a lot of what goes on with that drag things out and the paperwork and so forth is also just because we're trying so hard to manage scarcity, and we just need to get more resources into these programs. I think then we would be able to move a lot faster to help people. Now we have to spend a lot of time kind of winnowing through, well, who's the person that really needs the help the most, and waste a lot of time and money.
Next question. The state of Hawaii has yet to use a large portion of their CARES Act money. For other states with a large homeless populations exacerbated by the pandemic, what percentage of CARES Act funding have gone to homeless prevention and reducing homelessness?
I don't know what percentage of money is going to homelessness prevention. I do know that there are quite a few jurisdictions that are having trouble or have had trouble spending CARES Act money, particularly the Coronavirus Relief Fund, which all has to be spent by the end of the year. But also, I know a lot of jurisdictions have not distributed any, or have not distributed very much of their ESGCV funds. And sometimes this is because of bureaucracy, but sometimes it's just moving slowly. And that's a shame, because the needs are great.
I know at the city and county we've allocated all of our funds but haven't yet spent it all. So it's all dedicated for something. It just takes a little while to roll it out. So.
Yeah.
So this last question that we're going to do today has to do with enforcements or sweeps. When the SMI people, sorry, I'm not familiar with the acronyms, but
Serious
SMI
mental
people,
illness. Mm-hmm.
Ah, gotcha. Where they're often moved, are not welcome at the shelters if there are any openings. Often this is the reason many cite as to why they refuse shelter. What is your opinion on that?
So as I understand it, the person is saying that unsheltered people are not welcome in the shelters, and so they don't really have the choice to refuse them. Maybe, I mean, we low barrier shelters are obviously very important, and they sometimes people with mental illness. I've heard from many jurisdictions that when they've isolated people or quarantined people in the hotels and motels, people who have been unsheltered and have behavioral health disorders, which I would just mention are sometimes the result of homelessness more so than the cause of homelessness, they really do so much better not in private rooms. It's just a lot of people, if you have mental illness, it may be very difficult to be in a congregate space and also have to follow a whole lot of rules. So I think low barrier, non-congregate shelter would probably work a lot better for people.
Well, thank you so much for everything that you're doing for our homeless communities across the nation. And thank you so much for coming and joining us today at this virtual conference. And thank you to everyone watching for being so adaptable to this new way of meeting. I'd like to thank everyone for being here. That's about as much time as we have. I'd like to let you guys go so that you can go to your breakout sessions, but a big mahalo to our panelists today. I'd also like to remind folks, if you get disconnected, to go to honolulu.gov/housing to find the links to get reconnected, and also to find the links for your breakout session that you'd prefer to go to. I'd also like to remind folks who are looking for CEU credits that the link to the PDF download of the conference evaluation and CEU application form is also available online at honolulu.gov/housing, and just follow the links. Again, thank you to our panelists. I'd like to bid you a fond aloha, and I look forward to working with you all in the future. Mahalo.